urban residents. We'll turn now to some other news making headlines in the North State tonight. The Affordable Care Act. Now, whether you like it or whether you don't, it's coming. It's going to be here very soon. This morning, the Shasta County Board of Supervisors met to discuss the possibility of adding jobs to the Social Services Department to handle the influx of insurance applications when that act goes into effect. New at 6:30 tonight, KRCR News Channel 7 Shay Arthur spent the day getting the facts about what the new policy or that new health policy means to those in Shasta County, and she joins us now live. Hi, Shay.
Well, hey, Mark, changes are on the way. This morning, the Board of Supervisors approved a plan that would add 37 jobs to the Social Services Department. The employees will help people with their insurance applications as well as take customer service calls. The cost for these changes is expected to run about $2.2 million. Now today I met with a local doctor to see what the North State has in store once thousands more people become insured.
Suddenly we're going to have all these people that can afford to go into the system. Who's going to provide the care? Thank you so much.
Dr. Michael Jordy is a primary care doctor at Hilltop Medical Clinic in Redding.
Yeah, we got to get these stitches out.
On a Monday or Friday, he sees between 75 and 80 patients. So you're swamped.
We're swamped.
And come 2014, when the Affordable Care Act, commonly known as Obamacare, goes into effect, Dr. Jordy might be getting a whole lot busier.
Excellent.
An estimated 44 million Americans will have access to health insurance. More patients, but who will treat them?
I think it's all going to basically hit at one time.
A study out of the Journal of the American Medical Association says out of the 17,000 third-year medical students surveyed, only about 20% were planning to be a primary care doctor.
We'll get that taken care of. Take a look up here.
Shasta County officials tell me more than 15,000 people will be eligible for the new health care plan. And over a 5-year period, a little more than 10,000 people are expected to apply. And that's only counting those who are below the poverty line. Dr. Jordy says there are a lot of unknowns right now, but the county will have to get creative to provide an adequate level of care.
To design primary care facilities, something like Shasta Community Health Center, or private family practice groups, private pediatricians, etc., we're going to have more doctors and more mid-level practitioners there.
No one's really going into primary care.
Right.
There might be more PAs.
Correct.
Is that a good thing or a bad thing?
Well, I think it is. I think it has to happen if we don't have enough people able to train as physicians.
But ultimately, Dr. Jordy says while it's good more people will be getting care, Shasta County will need to step up their game with more incentives for doctors to stay in the area. And the public, he says, needs to think preventatively.
If you have mild medical problems, get them treated early so you don't end up with pneumonias or end up in the hospital. I think right now is kind of a time where we just need to be smart. This thing's going to work out one way or another. I think also don't panic.
And county officials tell me starting next month, meetings are expected to begin to discuss strategies for implementing those new health policies in our county. We'll keep you posted. Shay Arthur, KRCR News Channel 7.
All right.